Okay, welcome everyone. It's good to meet once again. On every Tuesday, we try to come together and discuss social issues, subject matters that affect our living. And today we are going to be talking about a very, very important subject, understanding alcohol addiction. There are so many people in the society today who are, affected by
It is
alcohol
not
addiction.
airing.
You're not able to hear me? Is there a problem for others also? Can
Yes.
others hear me?
Yeah, got
Yeah, okay.
We can hear you.
Yeah, okay. So basically, I think every now and then we will find people, maybe sometimes in our own family or in our neighborhood, in our society, in our communities, wherever we come from, there are people who are struggling with this, and it not just affects one person, but it affects the entire family. And before long, one person's addiction can actually destroy many more lives, and not just his or hers. So it's so important that we really pay attention to this session. It's not just about whether or not we have an alcohol problem, but we can really learn from this and in the correct way express care and concern for people who are struggling with this kind of addiction. Okay, we truly want to thank God for providing Dr. Sheryl John as our speaker this evening. Just a quick introduction of Dr. Sheryl John. Dr. Sheryl John is an eminent psychiatrist born and raised in Mumbai, a celebrated speaker on mental health. She has a thriving psychiatry practice as she consults at Dr. L.H. Hiranandani Hospital, Powai, and Holy Spirit Hospital, Andheri East. Dr. Sheryl specializes in treating young adults, women, and families. She completed her MD Psychiatry from the esteemed Medical Institute of Mumbai Lokmanya Tilak Municipal Medical College and Hospital, completed the training in the Kharkov method of counseling from St. Xavier's College, and did an online training module in DBT under Marsha Linehan, USA. She's on the board of trustee of FIAMC, which is International Federation of Catholic Medical Associations. She was, she was the honorary treasurer of Bombay Psychiatry Society, and she's a passionate advocate of community mental health. She wants to promote mental health awareness and contribute towards destigmatizing mental illness and conducts various talks across the length and breadth of the country. She's an invited speaker at both the national and international conferences. So a very warm welcome once again to Dr. Sheryl. We are so glad you're here. Truly, it's a testimony of your caring for humanity, for mankind. So thank you so much for coming here and sharing your wealth of knowledge and experience freely for the common good. So over to you, Dr. Sheryl.
Yeah, thank you so much, Abhijit Pastor, for inviting me. And thank you to the audience. I know it's past sometimes, sleep time for many people. It's almost 9 p.m. on a weekday. I don't want to kind of extend it too much and make people feel sleepy or hungry. So I'm just going to start sharing my screen. It's a very, very important problem that we need to talk about today. And why do we need to talk about alcohol addiction, right? Because of the myth associated with any kind of addiction. And probably this talk over the next half an hour is just going to create a little bit of awareness in the people who are attending this program about what do we actually mean by addiction. What is that person going through? So awareness is basically the agenda behind today's talk, but understanding the problems associated with alcohol, right? So can you tell me, do you think that there is a problem of alcohol, and is it an addiction or something that is a matter of concern? I know we're a few people in the group, so it's good to have an interactive talk. So you could just unmute yourself and let me know if you think that is alcohol addiction or alcohol a problem in society today?
Yeah, anyone? Please unmute and answer. Respond. Do you think alcohol is a problem in today's society?
This alcohol means that including all the kind of liquors that are rum, brandy.
Yes, sir.
Yes.
Why? Okay, yes. See, is it a problem if the actually that's in the view of the Bible? It should not be. It is not to take. Or some of the people took in that on the view of Bible, and they spoiled that family are spoiled. That is own that the Nova family. In that the Nova or some other family. And another thing that this alcohol is spoiling the that is destroying the regular income of the family.
So you
That
agree, sir, that yes. So thank you so much for that. You can actually mute yourself. Yes, so you agree that it is a problem, right? And even as Pastor Samuel said, or even Abhijit Pastor mentioned about how it impacts families. Now,
Yeah.
what happens is, as a society, uh, there's a lot of social acceptance of alcohol. Alcohol is used in parties very regularly. Um, if there is a baptism, if there is a Holy Communion, if there is a wedding, if there is a funeral, alcohol is served to many people. So there is a kind of acceptance that this is a way of interacting and socializing with each other. I have so many people who work in the corporate world, and they say, okay, doctor, I really want to cut down consuming alcohol, but what do I do? We have a meeting with some delegates who are coming, and the only way that we can interact with the other people, with my leadership team, or if I'm taking a team away for, let's say, a team bonding activity, alcohol is the only way that we can do that. And if I refuse to drink, then I will be the man left out, and I will not be able to get into the leadership roles, because this is a way of socializing. People say, no, it's okay. We're only drinking when we go out with friends once in a while. So there is a lot of social acceptance to alcohol as compared to, let's say, other drugs. So if I'm going to say, oh, I'm going to consume weed, or I'm going to take brown sugar, there will still be a stigma associated with it, but not so much with alcohol. And that's why the incidence and prevalence of alcohol consumption then increases. So there's a gradual progression in a problem. The first is the attitude. So we as a society have a positive attitude towards alcohol, which leads to most of the people experimenting with alcohol at some point in time. And a problem that we observe a lot nowadays is the age of experimentation is getting younger and younger. There was an incident in a school in Mumbai where seventh grade children had taken vodka in their water bottles along with water, and vodka and thumbs up were mixed. This was seventh grade. So I don't know, during my generation and earlier, probably the first time somebody would have tried alcohol would be when you go to a professional college, or an engineering college, or when you're in degree college. But the age of consuming alcohol is, or experimenting with it, is increasing because there is easy access. A lot of times we visit homes and we see that there is a whole area dedicated with a great furniture and very aesthetically done bar area in your homes. So the bar area is one of the places where there are, bar stools and decorative work done, and the father or the mother is very proudly showing off the different brands of alcohol that you have and how it's so old, and then how wine is completely okay. So, and then the experimentation starts early at home. Their parents are not there. And as a young adolescent, I just want to try and see how it tastes, right? That leads to a regular use, then to a heavy use, and dependence and abuse. And we know that alcohol acts as a gateway to a number of other drugs and substances. So we have to look at that gradual progression to understand what do we mean by alcohol addiction. Now, to understand how much percentage of alcohol is there, people say, oh, I just have beer. Beer has 5% alcohol. Or people say, oh, I just have a glass of wine. Wine has 12 to 13% of alcohol, which is a very, very high content of alcohol. And of course, the harder drinks like liquor and rum and vodka have higher units. So when you're comparing the alcohol quantity, the percentage of alcohol that you're having, even in a social setting, it's quite a huge amount of alcohol. To understand alcohol addiction, let's look at certain terms regarding alcohol. So, alcohol abuse is when it starts, you start experimenting and then you are using alcohol, causing certain behavioral changes. Either you're getting drunk once in a while, or your voice slurring, or you're not, they call it as an abuse. When there is some behavioral change happening, causing with the alcohol. What is the problem area? The problem is the addiction. When a pattern of alcohol consumption is involved with overwhelming involvement of the alcohol, everything is about the alcohol. My entire day or evening time depends on when will I be able to go and buy my alcohol? When will I be able to finish all the work that I have and responsibility that I have? Can I make sure that I have enough stock, that even if there is a lockdown that is declared, I have enough stock at home? And unfortunately, as a aftermath of COVID, when alcohol started being delivered home, earlier alcohol was not delivered home. You had to go to the wine shop to buy. And as a consequence of everything else being delivered home, alcohol also started getting freely delivered home. There was no restriction, of course, the first 1-2 months, and then it became an essential product to be delivered home. So then you were stocking up alcohol at home. So if you have to figure out that you have a problem with addiction, is when your entire day is focused on getting your next fix and you're apprehensive. I don't get my next fix. What will happen to me? What will be the symptoms that I have? So it starts with the abuse and leading to tolerance. So people say there's a very fine, thin line between social drinking and leading to dependence or addiction. What is the meaning of the word tolerance? For example, if somebody is drinking one peg of, let's say, whiskey, or having one pint of beer, or having one glass of wine, it causes certain changes in the brain. The person feels a particular way and enjoys that feeling. So the person will go back to experience that feeling and have the same amount of alcohol again. But when you do that on a regular basis, that same quantity of alcohol, whether it is one glass or whether it is one pint of beer, will not give you the same result. So you then have to increase your consumption of alcohol. So their one glass becomes two, and then the two becomes three. And that's how the pathway to dependence happens. So the same amount not giving you the desired effect. Withdrawal is a very, very important aspect of alcohol dependence. So somebody who has developed tolerance and then he chooses, okay, I'm not going to drink from today. I'm going to go cold turkey. It is a period of Lent and I decide to give up alcohol during Lent. Or it's Shravan and I'm going to give up drinking. If you have an abuse or a dependence pattern, it's very likely that you will develop withdrawal symptoms. What are these withdrawal symptoms? A person who is having a problem with alcohol will find difficulty falling asleep without the alcohol. Will start having tremors in the hands, the face getting flushed and red, a lot of sweating, changes in your blood pressure, feeling extremely restless, loss of appetite, feeling nauseous. A lot of times we have patients who get admitted in the hospital, for example, let's say for a fever, or could be an accident. And because there is a sudden disruption of the alcohol, the person will go into something that we call as confusion, or the person can have hallucinations, hearing voices, seeing things, tactile hallucinations, feeling insects are crawling across. And a worst case scenario is the withdrawal phase, say a person has alcohol dependence. Can you hear me, Dr. Pastor?
Yeah, there was a bit of a lag, but it's okay. Carry on, carry on. No problem.
Is it become better now?
Yeah, we can hear you, but I
Is
think
it
you're.
better now?
Yeah. Go ahead, please.
Okay. Please let me know if my internet is
Sure,
causing you problems.
sure.
So the dependence is when there are two factors there. So when will you say somebody is dependent to alcohol? When there is tolerance and when there is withdrawal. So tolerance means that the same quantity is not giving me the desired effect, so I am upping my consumption. And the second is when I don't take the amount that I take every day, I am experiencing all the withdrawal symptoms. And when we kind of intervene, like I said, a person decides, okay, he's not having a serious problem, or the person takes help for the alcohol dependence and changes and gives up alcohol, there is also very, very high chance of relapse. That means going back to the alcohol. There is 60% chance of relapse in the first year of trying to give up. So we as a society have to be very understanding and empathetic to a person who's struggling with this dependence. So when do I know that there is dependence? When there is a problematic pattern of use that is causing impairment in functioning. And if there are two or more symptoms within a 1 year period, what are these two or more symptoms? Failure to meet obligations. Because of my consumption of the alcohol, I'm unable to meet my obligations, whether it is at work, whether it is at home, whether it is in a social situation. I keep on using it even when I know it's a physically dangerous situation. I know that I have to drive back home. I know that I'm in a situation where I may be at threat or my family may be at threat, but I will still continue to use it. When I continue using it despite relationship problems, there are conflicts at home, like Pastor Samuel said, there is fights at home, there is a distress at home, but I'm still going to consume because I'm not able to give up. Despite financial problems, when you have tolerance, when you have withdrawal symptoms, when you're taking it for a longer amount of time than intended, you thought I would just take it for, oh, this is just for fun, but now it's become an everyday pattern. And no matter what you're trying to do on your own to reduce or control, it is not working. And you're spending a lot of time trying to obtain the substance. Your social work, hobbies, work activities have been given up or reduced. And you are continuing to use despite knowing all the problems that you have. You know that your liver function tests are raised. You know you have jaundice. You know that you're had a fit. You know you have a cardiac event, but you're not able to give up. So what are these physical symptoms? Long-term use of alcohol can cause dementia, memory disturbances, mood swings. It impacts each and every organ of the body, not just your liver. You can have irregular heartbeats, high blood pressure, kidney, stomach. All the organs get impacted when there is alcoholism. But alcohol is not just an individual problem, it's a family, because one person with alcohol and the entire family suffers. What is this impact? I'm coming back from work and I'm a person who is struggling with alcohol dependence. My whole criteria is how do I get my fix and feel better? So that means I will ignore my wife, I will ignore my husband, I will ignore my children. There will be constant conflicts at home, which is impacting the children, because after a particular level of alcohol will take away the inhibitions. So you will start behaving in an abnormal way. You will start saying words that you don't really mean to. And that impacts your family. Alcohol causes, like I said, a lot of disinhibition. So violence post-alcohol, domestic violence or sexual abuse increases under the influence of alcohol. I do not have to tell you about the number of road traffic accidents that we are seeing, which is not only impacting the person who's driving under the influence, but also innocent bystanders who are getting impacted because of the consumption of the alcohol by an alcohol-dependent person. What is the root cause of this alcohol dependence? The problem is that when I start using alcohol socially, like I told you in the beginning, right? I'm just experimenting with it. It is like this. It starts impacting the reward circuit in the brain. So alcohol, when I'm consuming alcohol, I'm taking one drink, it will release certain chemicals like dopamine in my brain, which gives me a sense of feeling great. And after some time, because I crave that feeling, I keep on going back to it. And this whole reward pathway in the brain getting impacted is the reason why there is alcohol dependence. So it is not because of a person's character being not strong enough or willpower not being strong enough. It's because of these changes in the brain. Again, people will say that, oh, everybody drinks socially, everybody doesn't get dependent on it. I have a drink once in a while, but my friend who's drinking is drinking every day. What are these predisposing factors? If you had childhood trauma and difficulties as a person growing up, if you have seen your parents struggling with alcohol use, if you start drinking alcohol much earlier in life, if you have symptoms of ADHD, that means you're a person who is inattentive, hyperactive, or impulsive, you have a higher chance of developing alcohol dependence. A lot of patients have depression and anxiety and use alcohol as a way to treat their depression and anxiety. And it's very important to identify that. So if you are somebody who's struggling with mood, feeling sadness, lack of interest, lot of feeling of hopelessness, worthlessness, symptoms of anxiety, and then you take alcohol. It calms down all these symptoms. So what happens is you're not treating your depression and anxiety, but you're just applying a band-aid over it with the alcohol. And that's why when we take care of the alcohol as a treatment also, we want to be sure that we're identifying a person with depression and anxiety and treat that first. So how do we know if you have a problem? This is something that we call as a cage questionnaire. So are you somebody who is following this cage? So what does the C of the cage mean? Are you somebody who's trying to cut down? Are you somebody, are you somebody who's getting annoyed or angry when people talk to you about your drinking? Your wife or your friend is saying, अरे मुझे लग रहा है कि थोड़ा ज़्यादा हो रहा है यार आजकल तेरा दारू. And you're getting irritable. नहीं ऐसा कोई problem नहीं है. Do you feel guilty about your consumption? Do you wake up in the morning and say, oh, kal zyada ho gaya. I should not have done this. I should not have behaved in this way. And the E is, do you feel so hungover that you need a drink first thing in the morning? If you fulfill any of these from the cage questionnaire, that means you definitely are struggling with a problem of alcohol. It is a beginning. It could be very soon lead to a dependence pattern. So if anybody who's listening thinks that I'm fulfilling this criteria, it's supposed to be a wake-up call for you. Now, how can I help somebody who has an alcohol problem? It's important, right? We need to help them. Just like you would help somebody who is having a heart attack. Just like how you would help somebody who's having a fracture. We as a society and we as family have to understand that from whatever I've said so far, that alcohol is a physical disease. It is a disease impacting the brain, and the person is not doing it just because he or she wants to do it. So we have to help. How do we help? This is Agnello. He did really well with treatment. We had taken him on treatment. After 3 days on his birthday, he treated himself to a drink and started drinking every day. And then everybody who got involved was getting very angry and dejected. And what do they say? You're useless. We have wasted our time and energy in getting you treated. We have taken you to church. The pastor has prayed over you. You have taken treatment from the psychiatrist. But there you go back and you drink. So it's very easy for us to say, oh, you're useless. You're good for nothing. Right? Patients with alcohol use face a lot of stigma and discrimination. And that prevents them from seeking treatment. So it's very important that we take care of the stigmatization and discrimination that we as a society or family do to a member who's suffering from alcohol dependence. So you understand this, addiction and the brain, any kind of addiction. So alcohol use and the brain, you have a predisposing factor. We have to take care of everything. So we have to take care of the psychological factors, pharmacological factors, and then we will be able to break this cycle that is going on of dependence. Can a person with alcohol just cut down the quantity? Very common question that family also ask. Because sometimes, like I told you, we have a person who's come with a heart attack to the hospital. And he's somebody who drinks every day. And now in the hospital, he's gone into withdrawal. I have family saying, doctor, just दे दो उसको एक drink, वो ठीक हो जाएगा, घर जाने के बाद कम कर देंगे. Can you cut down on your quantity? No. Cutting off or abstinence is the only way forward. There is no cutting down of the quantity. You will not be able to break that cycle. Because it's a physical problem, if somebody is having a dependence pattern, like I told you, the tolerance or the withdrawal, they must take medical help first. So we have a number of medications that we can give to reduce your withdrawal symptoms. Why do I go back to drinking? I go back to drinking because I'm feeling physically uneasy. I'm feeling restless. I'm not able to sleep. But the doctor can help you with that so that you're able to then give up alcohol. We can have a detoxification program for a few days. There are anti-craving medications that you can give to reduce the craving. Please, as a family, do not use the Ayurvedic preparations and spurious medications and mix it with the patient's food to give up alcohol. It can cause a significant life-threatening reaction. So take help from medical professionals for medication. A is a very, very important tool to help a person with alcohol dependence. The 12 steps of A, a sponsor in your A, your peer group in your A will help you to take care of your alcohol dependence. If you're suffering with depression, anxiety, then counseling, psychotherapy. Very, very important.
Yeah, I think you need to make the full form of A clear for some.
Yeah, it's Alcoholic Anonymous. So that's a group of people who are recovering alcoholics. They follow a 12-step program. You have Alcohol Anonymous groups all over the country, all over the city. Many hospitals have it. And they are an amazing support group for patients who are trying to give up alcohol. You also have groups for the family members of patients who suffer with alcohol dependence. So thank you. This is just a brief introduction upon alcohol as a problem. We can have question answers. So if you have any doubts or clarifications, we can do that.
Yeah. Yeah. Thank you so much for that wonderful session. And now we'll go to Q&A.